Okay, we're going to get started now. Welcome. Thank you for joining us tonight for our webinar on air pollution, COVID-19, and communities of color, what we can do about it. I'm Chris Sticks, one of the founders of Metro West Climate Solutions, the organizer of tonight's program. This is an all-volunteer committee that's made up of members of First Parishes in Wayland, Lincoln, and Weston, and the Congregational Church of Weston, and some individuals. Our committee's charter is to offer information on climate change and to provide activities for individuals to get involved in bringing about solutions to climate change. These include events like tonight's webinar and our monthly Climate Solution Events newsletter. Our sponsors tonight are the Union of Concerned Scientists and Conservation Law Foundation. For all of us who have loved ones, family members, or friends who are afflicted with coronavirus or who have lost jobs, our thoughts are with you. Tonight's program is focused on some of the most vulnerable members of our communities. Our moderator tonight is a senior attorney at Conservation Law Foundation. She focuses on transportation and environmental justice. She gained experience in environmental justice and climate change issues at the Department of Public Utilities and Alternatives for Community and Environment. Let me introduce Stacy Rubin, our moderator.
Hello, everyone. Thank you very much, Chris Sticks. In tonight's webinar, we will discuss the need to reduce pollution quickly and to do it in a way that explicitly includes and benefits people of color and other historically marginalized populations, because the data show inequitable public health outcomes. We will first hear from Zhao Wu, and then following with a great presentation from Paulina Muratori. We have an excellent panel of speakers who will discuss current research about the inequitable distribution of air pollution and COVID-19 mortality and how those topics intersect. First, we will hear from Zhao Wu. Zhao is a PhD candidate in the Department of Biostatistics at Harvard University and expects to graduate in 2021. His research interests lie in developing causal inference methods to address needs in the environmental health and public policy analysis of health claims databases. Zhao's dissertation work focuses on developing causal inference methods to handle continuous and error-prone exposures. Zhao has a Bachelor of Science and a Bachelor of Laws degree from Peking University and a Master of Science degree in Biostatistics from the Harvard Chan School of Public Health. And Zhao is a member of the research team who worked on a study examining the connection between COVID-19 and air pollution. Following Zhao, we will hear from Paulina Muratori, the senior campaign organizer for the Clean Transportation Program at the Union of Concerned Scientists. In her role, she manages the organization's transportation campaigns in the Northeast and Mid-Atlantic states, with a focus on mobilizing the Union of Concerned Scientists members, activists, and other experts to reduce tailpipe emissions while building a cleaner, more equitable transportation system. She also works with state and regional transportation coalitions, partnering closely with a wide range of groups to enhance our collective advocacy voice. Paulina earned a Master of Science in Environmental Planning and Policy from Tufts University and a Bachelor of Arts in International Relations from Boston University. After we hear from our panelists, we're going to talk about what we can all do and have a question and answer session. Please feel free to type questions into the chat. I will now turn it over to Zhao. Next slide, please.
Everyone, I'm glad to present here for our very recent research in the historical exposure to air pollution and its association to COVID-19 mortality rates in the United States, which is from our research teams at Harvard University. Next. So for a brief background, COVID-19 case has become a public health emergency around the world. It's sudden and have a global scope. So there are a lot of unknowns around this COVID-19 pandemic. However, it's really important to identify whether the environmental factors such as air pollution can impact the severity of COVID-19 cases or might explain racial differences in COVID-19 mortality rates. Next. So before we jump into our formal research, I would like to briefly introduce what is fine particulate air pollution. So fine particulate matters, also called PM2.5, is a general term for a mixture of solid and liquid droplets suspended in the air. So this particulate matters is super small. That's smaller than 2.5 micrometers in the diameters, which 5 times smaller than human hair. So it's so small that could inhale into the lung and through the nose and throat, and then cause the potential damages for human health. So those fine particulate matters could from various of sources. For example, the power plants, the motor vehicles, airplanes, residual wood booms. So you can name a lot of resources, sources for those fine particulate matters. Next. So there has been rich literature on the health effects of long-term exposure to PM2.5. So a lot of research have shown strong evidence that there is associations between long-term exposure to PM2.5 and a lot of human diseases, especially chronic diseases. For example, heart and lung disease, brain diseases, irregular heartbeats, and many other diseases around the lung functions or cardiovascular systems. Next. So why our teams want to investigate the effects of PM2.5 to the COVID-19 virus, especially the most severe cases of COVID-19 cases, which leads to death. So the main reason is that we already find, before any studies, we already find there is a large overlaps between the cause of death of COVID-19 patients and the disease that's affected by long-term exposure to PM2.5. So we hypothesized that because long-term exposure to 0.5 could affect the respiratory disease and the cardiovascular systems, it can also increase the severity of COVID-19 infection symptoms, and then may end up increase the risk of death for those COVID-19 patients. So we conducted our study. Next. So beyond that, actually here I would like to show a map that's it's a ratio maps around United States, and also the pollution maps around the United States. So you can see a clear link that's in the area that's have a higher percentage of vulnerable populations, especially those colored populations. They are also exposed to higher level of PM2.5, which is a higher level of air pollutions. Especially there are studies found that actually African American communities and Asian American communities that's living closer to the highways that's actually expose much higher level of air pollution annually. Next. So we want to find such association. So we actually draw a nationwide study that's using more than 3,000 counties, which almost include every 98% of US populations. And according to the 98% of populations, those more than 3,000 counties, we find that only 1 unit increase in long-term average exposure to 0.5 is associated with 8 increase in the COVID-19 mortality rates. The results is quite robust to different level of sensitivity analysis. So this results shows that if we compare 2 counties, all other conditions are similar. One county have 1 more units increase in the PM2.5 levels. Actually, these counties will have 8 higher risk of dying from COVID-19 than the people living in another county with a cleaner air. Next. So actually, our studies findings has been supported by a lot of other studies all around the world. That's from China, from India, from Netherlands, from England, from UK. So actually, this news report covered a lot of findings, a lot of evidence globally that air pollution makes the COVID-19 pandemic even more deadly. So next. So these studies have very important public health implications. So we want to prioritize counties that have more pollutants, either by strengthening the regulations or conduct additional precautionary measures in order to fight against the COVID-19 in those counties. And we want to focus on people of color and poor peoples because those people are disproportionately affected by air pollution. And in addition, the heavier air pollution could lead to larger health disparities. So that's the health implications for our studies. Next. So here is our website. Anyone that's more interested to our methods and the more messages around our study findings could see this website. Thank you.
Thank you so much, Xiao, and thank you to the Metro West Climate Solutions Group for organizing this webinar. And to CLF for co-sponsoring it along with the Union of Concerned Scientists. My name is Paulina Muratori, and I'm a senior campaign organizer with the Union of Concerned Scientists on our clean transportation team. As Stacy already mentioned, I manage our Northeast transportation-related campaigns. A big part of my job involves finding ways to advocate for clean transportation using robust analysis and science, while simultaneously forging partnerships, working in coalitions, engaging with the public, and mobilizing our members and Science Network members to take action. Today, I'm going to talk to you mostly about transportation-related air pollution, with a focus on a study that UCS came out with last year. And when I say transportation, I mean all on-road ground transportation, so trucks, buses, and cars. But first, I want to note that, as Xiao mentioned, there are many sources of air pollution, not just from transportation. So why are we focusing on transportation today? Next slide. Transportation emissions are on the rise, and this sector makes up more than 40% of total Northeast and Mid-Atlantic regional global warming emissions. It's also the largest source of emissions nationwide, but for the scope of today's webinar, we're talking about the Northeast and Mid-Atlantic. As you can see in this graph, the region has made progress in reducing other emissions from sectors like the electric sector. So you can see that has trended down, while transportation has trended up and maintained steady for quite some time. This has major implications for the quality of life for both people and the planet. If our states are to meet any of their climate goals, they must work swiftly to transform our current transportation status quo. Next slide. As we just heard about PM 2.5, we are now going to talk about how this particulate pollution comes from transportation. So the transportation sector is, in addition to being a major emitter of carbon emissions, is also a major source of ground level soot and ozone. And what you see coming out of this tailpipe in this picture leads not only to carbon emissions, as I just said, but it contains particles that hang locally in the air. The region's cars and trucks are responsible for more than 50,000 asthma attacks, 1,000 deaths and other pollution-related illnesses, and incur approximately 27 billion in total healthcare costs every year. In 2019, UCS decided to embark on a study that looked at transportation air pollution hotspots. So in other words, where, how much, and on what communities was this pollution happening the most? Next slide. On this slide, you can see a map of all of the Northeast and Mid-Atlantic states, which comprise everything from Maine down to Virginia. And what we're showing is the average annual concentration of PM 2.5 pollution from on-road transportation. The darker red colors are the heavier concentrations. We then looked at census tract level data to overlay racial groups. And this allowed us to quantify and compare the relative exposures across the region. And what we found was that communities of color breathe, on average, 66% more air pollution from vehicles than do white residents. And these numbers can be broken down a little bit further. Next slide. This graph shows you the disproportionate exposure to transportation PM 2.5. The numbers on the left will show you what percent more exposure each group faces. So to give you an idea of what the numbers actually say, across the region, Latinx residents breathe on average 75% more PM 2.5 than do white residents. For Asian Americans, that number is 73% more, and for African Americans, that number is 61% more. So for many, these numbers are striking, but sadly not at all surprising. Environmental injustice and systemic racism have led to a system that places pollution burdens disproportionately on communities of color. Decades of decisions about where we've built roads, highways, housing, where to invest in public transportation have all contributed to this picture that we see today. And in many cases, local, state, federal transportation policies have left communities of color with inadequate access to public transportation, divided by highways, breathing polluted air by congested roads. COVID-19 has shown with abundant clarity that those who have been most impacted by the pandemic are also the same exact communities that have historically borne the brunt of disproportionate air pollution. As we saw from Zhao's presentation, even a very, very small increase in long-term exposure to PM 2.5 pollution leads to an 8% increase in COVID mortality rates. These are very significant numbers. This is an unacceptable trend, and we need to do better. Next slide. The good news is that there is a lot we can do both locally at the state level and regional level to fight for a more sustainable, equitable future as we emerge from the COVID-19 pandemic. And today I'm going to talk about one opportunity that is in front of us, but I want to make sure to mention that this is not the only option, and we have lots of transportation solutions that we are going to need in order to truly move away from burning gasoline and diesel in our trucks, cars, and buses. But one opportunity in front of us now is a program under development called the Transportation and Climate Initiative. For the past several years, Northeast and Mid-Atlantic states have been working together to create a regional initiative that would cap transportation emissions on a regional level, generate revenue, and invest directly back into clean, modern alternatives. One of the most powerful aspects of this is the fact that it's regional in scope. Together, the states involved have a total population of 72 million people and a GDP that's larger than any country other than the US and China. And as we all know, pollution does not respect borders. So the larger the number of states involved, the better. Next slide. We do really have a better system within reach. And we must ensure that any states participating in this regional initiative invest in clean solutions like electric buses, enhanced bike and pedestrian infrastructure, electric cars, modern, expanded public transportation options. Next slide. So how would this program actually work? This slide gives you an idea of the nuts and bolts of the mechanism, which is known as cap and invest. First, the participating states agree on an overall pollution cap. And when I say pollution, I mean on-road gasoline and diesel that powers cars, trucks, and buses. Over time, that cap declines. Second, polluters pay. Importers and suppliers of gasoline and diesel pay a fee for the amount of pollution that they are selling. Third, states create a clean transportation fund using the polluter fees, allowing communities across the region to invest in sustainable, equitable, and modern transportation choices. In December of this last year, just a few months ago, participating states released a draft memorandum of understanding for this program, along with some modeling results. We expect that the states will come out with a final MOU by the end of 2020, and that the program would be implemented in early 2022. We need to make sure that the states actually get this program across the finish line, but more importantly, if it is to move forward, we need to make sure that solutions are prioritized in communities that have historically borne the brunt of air pollution, and where we've also seen deeply inequitable COVID-19 outcomes and other cumulative impacts. My colleague Stacy Rubin from CLF will now walk us through some of the modeling results and potential benefits from the TCI program.
Thank you very much, Paulina. We will be emailing the slides to all registrants and post the recording online. So to those of you who are taking notes, feel free to continue to do so, but you don't have to. We will make all of this information available to you. So as Paulina noted, the Transportation and Climate Initiative, or TCI, is not a final program yet. And we will be discussing ways for you to make your opinion heard about TCI. So this slide talks about the TCI jurisdictions modeling that occurred. So the TCI jurisdictions, again, ranging from Maine all the way down to Virginia, including Washington, DC, hired a third-party consultant, Cambridge Systematics, to look for some potential benefits that would result from the Transportation and Climate Initiative. So this slide is demonstrating that for the illustrative purposes in the year 2032, which would be the end of a proposed 10-year time frame for the TCI program to be in effect, there would be expected benefits that would be greater if the pollution cap was higher or more stringent. So the benefits range from 306 to 1,014 fewer premature deaths. That really depends on whether the cap is set at 20% of the emission reduction between 2022 and 2032, 22% cap reduction, or up to 25% cap reduction. I will say that Conservation Law Foundation, the Union of Concerned Scientists, and a number of other advocacy organizations have been advocating that the TCI states set the cap at least as stringent as 25%. And to the extent that you feel strongly about this issue, we encourage you to make your voice heard. So additionally, the TCI States modeled that we would expect to see approximately 459 to about 1,700 fewer injuries resulting from traffic accidents. And we would see a total monetized public health benefit of between $3 billion and $10 billion. Again, this is all illustratively just in the year 2032. Next slide, please. The investments that would be resulting from the pollution payments would generate annual proceeds that could range from region-wide 1.4 to $5.6 billion. So in this slide, this is a list of the potential TCI jurisdictions and what we might expect to see in the year 2022, which would be the first year that TCI would go into operation for the states that agree to sign on to be part of the TCI program at its commencement. So for example, you can see that we would expect in 2022 approximately $270 million to come to Connecticut, and that number would increase to $485 million in Massachusetts, and in Virginia we would expect to see a higher amount of $845 million. So the numbers that are on this slide would be the amount that would be generated if the TCI states set the cap at a 25% cap. Again, that means reducing emissions from the transportation sector, 25% between 2022 and 2032. Next slide, please. As Paulina mentioned, it is absolutely critical that we implement the Transportation and Climate Initiative in a way that is equitable and explicitly benefits communities of color, low-income communities, and other historically marginalized populations. So Conservation Law Foundation, along with Union of Concerned Scientists and others, submitted a comment letter to the TCI states with some recommendations for how TCI could be done equitably. So we recommended that each jurisdiction establish a community advisory committee. It's critical for people who are directly impacted by this program to be able to share their opinions and have those opinions actually matter to see how the program will be implemented. So that community advisory committee would recommend ways to mitigate any potential costs that might be passed down to low-income drivers as a result of the program, and would be tasked with overseeing the creation of quality jobs. We've also recommended that each TCI jurisdiction commit a minimum % of investments to priority populations. And what we mean by priority populations are potentially communities of color, people with disabilities, low-income populations, communities with limited English language proficiency. That would differ in each of the jurisdictions just depending on the population for that state. It's critical also for each jurisdiction to define what are priority populations. We don't expect that there will be a uniform definition among all of the TCI jurisdictions, but that's something that we think the Community Advisory Committee and interested stakeholders can influence. And finally, we recommended that each TCI jurisdiction measure and evaluate the benefits of the program. The Community Advisory Committee, again, would be tasked with recommending an evaluation tool, and we would ask the TCI states to use the information from that tool to make sure that the investments are being made equitably and to revise any investments that are not being dispersed in the way that maximizes benefits to those priority populations. So the last thing I want to say before we open it up to questions and answers is that we really need you and others to talk about what you think about this Transportation and Climate Initiative. You can take action by contacting your governor and also submitting comments to the TCI states. There is an online website, and we will be providing links for ways that you can get in touch with your state or city leaders and how you can submit those comments. So next slide. We are now going to turn to question and answers. Thanks so much to many of you who have already input questions into the chat box. I'm going to start with a question for Zhao. One question came in earlier during your presentation. there have been reports that men are more likely to die from COVID-19 than women. Does this suggest that there's a chromosomal sensitivity to COVID-19?
This is a good question. I think it's still too early to draw any conclusion about this. But I think there are many other factors could impact the difference mortality rate among men and women. I think, for example, a man have a higher smoking rate, and this could lead to preconditions like decreased lung functions among men. And also, I don't know whether there is any studies that's study the air pollution exposures among different gender populations. I don't know that, but I think it's still too early to draw any conclusion about these questions. There are many directions could partially explain this difference.
Thank you very much, Zhao. And a question for you, Paulina. What will the impact of TCI be on PM 2.5 levels?
That's a good question. And I think one of the things we'll send around in a follow-up are the results to some of the modeling that goes deeper into these questions. But essentially what we can expect is that as we are able to invest in clean solutions, that we will see a co-benefit of reduced PM 2.5. And the proof really is in the pudding of kind of when and how that happens. That's still a big question of where and in what sort of decision-making structure those investments will come. So we do need everyone to stay engaged and help make these decisions. And Stacy and I are both involved in a state-based coalition in Massachusetts, as well as in the region of advocates working on this, but we certainly need everyone to speak up and let their governors know that investments from the program should be invested in ways that will decrease particulate matter pollution. And the other thing I would say is, until the program actually happens and is evaluated, maybe 3 years into it, we won't actually know for sure. But for now, we need to fight as hard as we can to make sure that it's as strong as possible.
Thank you, Paulina. And I will just also add that the TCI jurisdictions have done some preliminary modeling, which they are planning to supplement in the next couple of months. They've estimated that there would be reduced PM 2.5 emissions ranging from 78 short tons under a 20% cap reduction scenario up to 333 short ton emissions reductions under the 25% cap reduction scenario. So just as Paulina said, those numbers are already estimated. We would absolutely expect to see a reduction in PM 2.5. Next, how can a regional cap ensure that disproportionate air pollution in low-income communities and communities of color be significantly reduced and actually result in reduced health disparities and health inequities? Paulina, do you want to start?
Yeah, I can start, and then Stacy, feel free to fill in. So I guess I would first say the cap itself is not what is going to determine that, but it is the rest of the sort of nuts and bolts and what falls after that. And like we've mentioned, there are several details yet to be worked out, and some of them, one of the biggest ones I think in particular, is urging states to actually get pretty clear on how they would define quote unquote priority areas, overburdened communities where clean investments could go first. Some states already have infrastructure in place that can help decide that, but that has not been sort of laid out regionally. And that's a really important next step. And again, how to ensure that specific spots of PM 2.5 are reduced or eliminated, I think speaks to the need of, again, how can we identify what goes there and additional policies that fall into place with this. TCI is not the only thing that's going to solve our problems. It is one major piece, but we need a whole lot more too.
Thank you, Paulina. I agree. And I'll also add that it's going to be critical for the investments to be targeted to communities that would most benefit. So if we have a minimum percent that is invested in communities of color, for example, by ensuring a conversion from diesel school buses over to electric school buses, that will absolutely have an improvement in air quality and would help to address the health inequities that we see in communities of color and other historically marginalized communities. Next question. Which states are showing the strongest support for TCI and which need help to get a strong framework in place? Paulina, can you take that one?
Sure. I would say sort of the bottom line is that no state has officially signed on, but we have indeed seen stronger support from some governors or some state agency staff than others. Massachusetts comes to mind first as a particular leader in the region, but I think the most important thing at this point is that no matter what state you're in, if this is something you feel that you would like to help get across the finish line, your governor's office, your state officials need to hear from you that this is a priority and that you think that it could have tangible benefits for your state. If they don't hear from enough stakeholders, they may not fully understand that this is something that could become a reality. So I don't think I'll stop for there.
That's great. And it's important to note that, again, TCI is very much under development and there is absolutely still opportunities for you to share your input and for us to influence what that program design looks like. And this is a critical moment because the TCI states are still deciding who is going to join the program and what the final details will look like. One question is whether communities of color support TCI. Paulina, can you take a crack at that one?
Sure, and feel free to also jump in, Stacy. That's a big question. I think one of the things with this being such a large scale region-wide initiative is there are, states have handled outreach and engagement differently across the board. And I think Stacy and I are lucky in Massachusetts to be part of a very broad coalition. We work very closely with our EJ partners here on these issues. And that's not necessarily the case everywhere. So it's hard for me to say sort of like broadly, do communities of color support TCI, but I think you'll see a variation across different contexts and different environmental landscapes.
I agree, Paulina, and there is no one group who speaks for all communities of color. So certainly everybody is entitled to their own opinion. And what we are advocating for is that people who are directly impacted by TCI, which includes communities of color, should be at the table working directly with the state officials to be helping to frame what the final program design will look like. Next question. Is there a reason that you did not look at PM2.5 emissions from airplanes? Paulina, can you address that for the UCS study and also perhaps why TCI is not covering airplane emissions at this time?
Yeah, that's a great question. I guess the part about why the UCS study didn't include aviation, the most helpful thing I can share is that we will send the methodology along with our study so that you can take a look at what exactly we looked at, because I don't want to take up too much time. But in terms of the fuels that are covered under TCI, Stacy, do you want to take that one?
Sure. As I understand it, the TCI states were focusing on a cap and invest program that is able to cover content that is within their jurisdiction. And I think regulating airline emissions is a bit complex and implicates some federal law. So the TCI states are focused first on the mobile on-road emissions. Next, we have a question for Zhao. Since we are in an era where the political implications of science research seem to lead to attacks on the science, can you please comment on the political controversy, if any, around the PM2.5 study?
Yes, definitely. So yeah, there is a controversy around studies and the whole as, for example, the PM2.5 regulations. I would say it's definitely really important to keep the regulations at least at this, especially during the COVID-19 pandemic, because our studies show there is associations between PM2.5 exposure and COVID-19 mortality. So there is definitely not an ideal way that's to especially draw back those regulations during this pandemic.
That's great. Thank you, Zhao. And here's another question for you. What type of information or additional studies should we be asking states or counties to do in order to better understand the impacts of PM 2.5 pollution on COVID outcomes by demographics?
Yeah, I think it's extremely important to acknowledge that there are several limitations in our study. For example, right now, the health departments all around the country for each state only publish county level aggregated data. So we can only do analysis on the county level. However, definitely there are actually quite heterogeneity within the county. For example, different communities have huge different level of exposure to the PM in the past 20 years, even they stay in the same county. So I would say that's definitely for the states, it's worth to look at a finer resolution of geographic regions in order to better understand the link between PM 2.5 and COVID.
Excellent, thank you. Here's a question that I think both of you can answer, but I'm going to start with Paulina. How can entrepreneurs and venture capitalists help, especially because policy takes time and requires money for implementation? So perhaps Paulina, you can comment about how entrepreneurs can help policy, and Zhao, maybe you can comment on how that might be helpful from a research perspective.
That's a really interesting question. I think that while policy does sometimes take some time to move forward, there are things that can be happening in innovation and in the market that can help kind of shift the context. So, for example, innovative ways of getting around that come to bear in the interim that may entice people. For example, right now, we've seen a huge spike in biking and walking. And so finding tools and technologies that allow people to better do that, which is a lower form of transportation and also has huge health benefits because you're moving your body, is great. And I think that otherwise, there's definitely a role for that kind of constituency to play in just speaking up for the policy to move forward in a particular way.
Thanks, Paulina. Zhao, do you have anything you want to add?
Yeah, I think as first I agree, and I guess that's pretty much what I want to say as well.
That's great. And we have time for one more question. So Paulina, I'm going to direct this to you. Shouldn't TCI investments be targeted to reduce sources of PM 2.5 that affect EJ communities, but may also be more regional, such as those that are exposed to highway traffic rather than just simply investing directly in EJ communities?
I think the entire answer to that question is yes, but yes, TCI investments should be targeted in areas that are experiencing high levels of PM2.5 in historically overburdened communities of color. I think what we will probably end up seeing, because at the end of the day, each state is going to formalize some kind of process to make the decisions about how to spend this money. We will see a range of options, sort of a menu of what the investments can be or will be, and that is still up for discussion. And I encourage all of you to submit your ideas as to what the state should do. I just lost my train of, the other thing I was going to say is that I've said this before, but I'll say it one more time, is that TCI is one piece of a much broader puzzle of how we transform our transportation system. So it does not give us infinite amounts of revenue to invest. It is a finite amount at the end of the day. So we are going to need a lot more funding mechanisms and tools and solutions to bring us into the world that we need to see.
Absolutely. Thank you, Paulina. And I'll just put in a brief plug for the fact that there is pending legislation in Massachusetts regarding environmental justice communities, and also federally an Environmental Justice Act. Those are two pieces of legislation that absolutely need to move in order to achieve our broader goals of achieving a reduction in health inequities. Next slide, please. I'm gonna go toward the finish line here. So here's how you can take action. We encourage you to contact your governor or your mayor if you are a resident of Washington, D.C., and let them know what you think about the Transportation and Climate Initiative and anything else that you want them to know. We will be circulating the slides after the presentation so that you will have access to this contact information. So don't feel the need to write it down quickly right now. Next slide. Further, there is an online website where everybody is invited to submit comments regarding the Transportation and Climate Initiative. So we have a link to that online portal. Not only can you submit comments in that online portal, but you can see the tens of thousands of comments that other people have filed, including comment letters from Conservation Law Foundation, Union of Concerned Scientists, and plenty of others. So with that, I'm gonna turn it over to Chris Dix.
Before we close out, I want to encourage you to sign up for Metro West Climate Solutions event newsletter by emailing subscribe to metrowestclimate@gmail.com. And next week on June 4th at 7 p.m., we are doing a webcast on the roadmap to carbon neutral for Massachusetts. This is legislation in Massachusetts that would provide a roadmap to Massachusetts becoming carbon neutral in 2050. With that, I'd like to very much thank Stacy Rubin, Xiao Wu, and Paulina Murator for presenting, and to our sponsors, the Union of Concerned Scientists and the Conservation Law Foundation. I would also like to thank all of those from Metro West Climate Solutions who helped put this program together, and the Lydia Maria Child Fund for Social Action at First Parish, which provided financial support. And all of us would like to thank you for joining us tonight. Please be safe.